Hi, everybody. Welcome to Healthline. I am Gregory Zarian. Merry Christmas. It's Christmas Day. I hope you had an amazing Christmas Eve. And what did Santa bring you? Did you leave out your milk and cookies? And did he bring you everything you wanted? Were you with your family? Did you? And here's the best gift. You can get everything you want or everything you ask for, but the best gift from us to you is health and wellness. Just look at your family and your friends and say, I love you, and be grateful for them, and everything else is a surprise. So we here at Healthline hope you got tons of surprises. Our topic today is all about spine surgery and back health and wellness. But before we dive into that, we have a couple things we want to share with you. How grateful we are for you, our viewers, and everyone that tunes into us once a month to check in on your health and wellness and what we're doing at Glendale Adventist Medical Center. You know, the mission for the hospital in this show is about you and about passing on health, wellness, and all you need to know about leading a healthy and self-fulfilled life. The mission of Glendale Adventist Medical Center is all about God's love and whole person care. So we hope that you take care of you and pass on everything you need to know to the ones that you love. Okay, back to the topic. Your back. There are 24 discs in your back. And joining us are superstars associated with Glendale Adventist Medical Center, Dr. Matthew Chong, orthopedic and spine surgeon, and Dr. Eileen Chen Wong, holistic doctor, non-operative, and physical medicine. How are you, doctors?
Good.
Did I do that well?
You did.
Okay, before we go into our first break, our back. What's the one pet peeve both of you have in regards to people and the way they treat their back and spine?
Well, I think my pet peeve is that a lot of people feel that they don't have to take care of their back, especially when they're in their 30s and 40s and they become more sedentary in their job, and they just think that their back will be like it was when they were 16.
Which is a lie. Dr. Chong?
Yeah, the back is it's constantly under stress in everyday living, and so I think one of the frustrating points is really to change the way we feel about our back means changing our lifestyle, which can be difficult.
Absolutely, because a lot of people like me, hey, change, okay, do not go away. More on what you need to know about back, spine, and neck wellness. And I have one quick question. So if you get something or you got something today for Christmas that you didn't like, do you open it and go, oh my gosh, this is so great, and your mind is saying, I hate it? Or do you open it and go, you know what, I'm really not that interested in this, thank you, do you have a gift receipt? Do not go away. More from us and your back and spine when we come back. Welcome back to Healthline. I am Gregory Zarian. Merry Christmas. Okay, and ready? Snora vor zulpzunund. You have Nordari, which means Merry Christmas and Happy New Year. See, I speak Armenian for all of you that don't think I do. Okay, so it's all about Christmas, health and wellness, and our topic today is about your spine, your neck. But before we dive into that and join our superstar doctors, I had a question. If you get a Christmas gift and it's something you don't want, for example, years ago, I opened the box and it said a sandwich maker, and I said, really? Is that what's in the box? And the guy that gave it to me said yes. So I now know Christmas etiquette is when you open something and you're not that pleased, look for the gift receipt. People, come on. Okay, it's all about your spine, your back, your neck. Joining us is Dr. Matthew Chong, orthopedic surgeon and spine specialist, and his partner in back health crime, Dr. Eileen Chen Wong, holistic non-operative specialist, and she is a superstar in physical rehabilitation. Doctor, if you get a gift and you don't like it, do you tell the person?
No, I don't.
Okay, you're good. That's good, doctor. Okay, you're a boy. Do you make a face? Like if your wife gives you something, you're like, oh, I
just keep smiling.
Okay, so at the end of the day, just keep smiling. Doctors, before we dive into back and health wellness, give me a little bit of your history.
Well, I went to medical school in Wayne State, which is in Michigan, but I'm a homegrown Southern California girl.
Yay, Cali.
I went to UCLA, go Bruins, and then I came back to California to do my residency training in physical medicine and rehabilitation in Loma Linda. And now I'm here.
So happy to have you, Dr. Chong.
So I'm a native of Chicago, and I went to school at Northwestern, both for college and medical school.
Yay, Chi-Town.
Then I wised up and came out to the Fair Coast here. I did my residency training in orthopedic surgery at USC at LA County. And then I did an extra year in a spine surgery fellowship down at University of California, San Diego.
And now you were part of the Glendale Adventist Medical Center team.
Yes.
So happy that both of you are here. Doctor, what is the main cause for back pain? Because everyone talks about it.
Sure.
A gentleman, Dr. Wong, what do you think?
I think the main cause for back pain is a lack of understanding about how to protect your back and prevent further back injuries. But in the different population, the main cause of back pain is actually just degenerative tear, wear and tear, degradation of the joints in the back. There's a lot of joints in the back, and like you said, a lot of discs in the back as well.
Dr. Chong?
Yeah, I absolutely agree, as I think you separate it to some degree by age profile. We have a bunch of younger patients who their risk factors are injuries, lifestyle.
Well, injuries meaning sports.
Correct.
So, okay, because then earlier, Dr. Wong, you said something like from 30 on, like 30 to 50. Is that where you mean the degenerative and just wear and tear? In the early stages of arthritis, right?
Right.
Okay.
Yeah, we say that arthritis generally starts about age 35. And some of these changes can be evident on imaging in patients that actually have no symptoms. But after age 50, if you don't actively prevent back injury, you can have more and more wear and tear through the joints, the ligaments, and the muscles, and even the discs, resulting in back pain.
I want to address some of arthritis in another segment. Back pain and sports injuries. What are some of the common reasons for that?
Yeah, I think to some degree everybody has to have a knowledge of pre-game or pre-ritual stretching.
Okay, so I'm all over the map because I want to.
Sure.
Pre-game, pre-ritual stretching. I'm an avid spinner. I'm an avid. You'll love this. I do lots of Bikram yoga. I love getting out there. There used to be a lot of conversation about stretching, then not so much, and now it's back to, the rollers and using the tennis ball and doing all this. Why is there so much conversation now about stretching associated to the back that it comes and it goes?
Well, I think beforehand, before your activity, stretching is important because it does minimize the chances of back injury.
Okay.
I think back injury in general happens when the back is unprepared and is subjected to some kind of physiologic or super physiologic stress, like you're getting on the spin bike. And so to some degree, I think it's just sensitizing your body to the activity that you're about to undergo.
How much should someone stretch, Dr. Wong, to be okay before they work out, and then how much should they stretch after they work out?
So that's a really great question. So the research shows that stretching after an activity is usually better, and that stretching beforehand is not needed. However, in a lot of high-level athletes and dancers and people who overarch their backs, they overstretch. And so what you need to know is that actually you can overstretch pretty easily in yoga and ballet. It's actually strengthening up your core and activating your core at the moment of the exercise, and then stretching after the activity.
So between 5 and 10 minutes before, and then 5 and 10 minutes, maybe even a little bit longer after the activity.
That's correct. But don't overstretch in the beginning either. You have to stretch when you're a little bit warmed up. And so usually we like to tell our patients to actually warm up with like 5 to 8 minutes of aerobic activity, so your core and all your muscles
So you
are
warm up
actually
a little
soft.
bit.
Yeah, you don't just go into that big stretch.
Okay, because a lot of people will immediately go to the gym or go to a class or something. They'll be stagnant and sedentary for most of the day, other than walking back and forth to their job or their car or doing whatever, and then start getting into all this movement, which can ultimately hurt you because your body's not prepared for it. True?
True.
And I love the fact that you said yoga, because I'm a huge yoga person. Okay, more with Dr. Chong and Dr. Wong when we come back. And here's the thing. Take a deep breath in and a deep breath out. And why don't you do a little stretching? More on what to do and how to keep your back healthy when we come back. Welcome back to Healthline. Again, breathe in and breathe out. And also while you're watching, it's just stretch up, stretch down, stretch your neck back a little bit, and get some exercise while you're watching it. We're all about our neck and our back health on this episode of Healthline. And before I dive into that, Glendale Adventist Medical Center, did you know they are ranked 4 out of 5 stars by the Centers of Medicare and Medicaid Services for its star ratings? That's in the top 20% of California. Glendale Adventist's mission is whole person care, health, and wellness. Joining us are Dr. Wong and Dr. Chong from Glendale Adventist Medical Center. Doctors, I get excited when I talk about stretching and whole person care and health and wellness, because I believe that a lot of what we do can be preventative. You know, somebody just doesn't wake up obese. Somebody, other than hereditary maladies, it happens on a day-to-day basis. Back pain. We talked a little bit about, we're going to revisit arthritis, but we talked a little bit about, you know, you can hurt your back by diving into something, an exercise without stretching. What are some of the common causes for back pain?
Yeah, so I think probably the most common cause is having a weak core that cannot provide soft tissue support to the back, even during everyday activities, not necessarily with a specific injury, for example. We see it time and time again, even so-called athletes and guys who tend to be pretty active don't always necessarily have the strongest core, and that is a risk factor at all times for injuring your back.
When you say core, a lot of people are like, I don't know what my core is.
Sure.
Doctor, tell us what our core is.
So your core is actually
And
the
I'm gonna be the
front
guinea
and the
pig.
back,
Okay.
right? So you have the rectus muscles, abdominal muscles in the front.
I'm going to stand up, guys. Can you get this? Okay, so, and here's a great point too, we'll talk about posture. Okay, so when you speak of the core.
So the core actually, there's 3 parts of it. I like to
Okay.
think of it. I like to think the front part, the muscles here, the obliques on the side, the flank muscles,
okay.
and also the lats, and also in the back. So a lot of people, when they lift, or if they're overarching their back, they're not actually supporting adequate antagonistic muscle contraction in the front. So they might be just throwing their back out if they're lifting a lot, or even the athletes do this a lot. If they just start powerlifting or clean jerking, they're just throwing out their back. Or the dancers, they're just overstretching. So what happens is you actually have muscle injury in the back muscles in the back. And this is what we call very commonly myofascial back pain and myofascial back strain.
So what is an easy way, other than there's sit-ups and a lot of exercises, how does one strengthen their core?
Well, the number one thing to prevent injury in that is not to overlift too. I think a lot of people, they will tend to push their limits, their physiologic limits.
But also when people overlift, you know, you see a lot of guys at the gym pick up weights and just throw things up and there's nothing engaged. So for an example, when I'm on a spin bike, I'm on a bike like this and my posture's like that, and the instructor always says, engage your core.
Yeah.
That just means tightening your stomach muscles and the core through here.
Mindful movement.
Okay, did you hear that?
Yeah.
Mindful movement. So instead of going down and picking something up like this, mindful means going down, engaging your body parts, your core, coming down, picking it up, placing it down, and being very aware of what parts you use.
And being aware of what you're able to carry as well. I think a lot of us, you know, even as a physician, I think I will try to lift up a patient when I really should be getting some more help to do it. Yeah, knowing yourself is really key.
I love that.
Injury.
And also, gentlemen, it's also about being a gentleman and being chivalrous. Since I'm standing, let's talk about posture.
Yeah.
I see a lot of people stand, you know, pelvis forward, pelvis back, shoulders hunched down. What is the proper way? And a lot of people talk about back pain, especially because, you know, retail, people stand on the floor and they end up hunching. What is proper posture, doctor?
Yeah, so the issue with posture in people is because we have these weak cores, there's unbalanced muscle contraction.
Okay.
It basically causes this almost hunch as you described. In a sitting and a standing position, I always encourage the most erect posture possible.
Can you
do
be
that-
over? You can stand like this.
Sure.
but that's-
So to do that, really what it involves is you want to be able to, it's almost the equivalent of squeezing your shoulder blades
Okay.
together to encourage that chest out, shoulder blades back posture. And that's kind of a natural reversal to this hunch that a lot of
Oh, I
people
love that.
exhibit in the sitting position specifically. The other thing I tell patients, and it goes just along the lines of what Dr. Wong was talking about this kind of mindfulness about your posture and the way you're moving. A lot of people, especially in the sitting position, have this kind of forward translation of their head.
Okay.
And in addition to squeezing the shoulders back and chest out, it's that mindful thought of keeping your head back to keep it aligned over your spine instead of in front of the spine.
There's also a great thing too that I heard is you kind of feel like a string is pulling you up a little bit.
Correct.
And if you go like this and you just feel that string, because this is not helping you, it's just being a little bit
Correct.
like your shoulders over your hips. And also pay attention too, because I ended up getting back pain because my feet would go in a little bit when I was at the gym and also extend. It's just being mindful.
And
So
the
thank you for that.
difficulty too is, you know, if we're not emphasizing the core, if we're not emphasizing strengthening the core, people can be mindful of what a good posture is, but if they don't have the core to support it, that posture is going to fade, especially if you have to sit for prolonged periods of time or if you have a very active lifestyle or a job. And so, again, it all kind of harkens back to focusing on that core in terms of stabilizing your posture in the long run, too.
And also when people sit at their desk, it's be mindful ergonomically when you sit at your desk. Be up, have your feet down. One thing we talked about once on Healthline is stretching. So when you're at your desk for almost an hour, get up, take about 10 minutes, do some stretching. Just get your body moving so you don't become sedentary and just sit like this, which then ends up messing up your neck, messing up your back. And people will be like, how did that happen? Well, if you're sitting at your desk for years and years and years, it just happens through time.
And we know that people who have jobs that involve prolonged sitting are at a risk. It is a risk factor for developing back pain. Sometimes it's as simple as we know from biomechanical studies that the most pressure through a disc is exerted through the sitting position, not actually through standing, laying, walking, or running. And so one of these issues is that people who sit for prolonged periods of time have all of this pressure accumulating in their disc. And so what I tell patients is, prolonged sitting is something to try to avoid. And if you can accommodate in your work to be able to take a standing break, to be able to stretch, to be able to go take a water break or use the restroom every so often, it can definitely help overall minimize the chance of experiencing chronic back pain.
And also, too, when you're sitting at your desk, move your feet. And I'm standing up again, guys. And also, when you're at your chair, go like this. It's just elongating, even if you want to stretch like that. A lot of people will crack their own neck at their desk and do all that. Is that good or bad?
So cracking your joints sometimes can be good. It puts you back into alignment, any type of joint. However, if you overdo that, you can actually stretch out the ligaments that hold those joints together. What I believe is that the joint is as strong as the ligaments and the muscles around it. And if you can overstretch your ligaments, you can actually damage the joint and damage those discs. And you can cause yourself some nerve damage even.
So you can hurt yourself by trying to alleviate something.
By overdoing it, that's correct.
I love that you said that. Thank you. So then bottom line is people can actually hurt themselves by overcracking.
That's correct.
Well, I can't do it, so it's great. Okay, more with Dr. Wong and Dr. Chong and back and neck health and wellness when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian. And did you know that Glenville Adventist Medical Center received the 4th consecutive A hospital safety score from patient safety organization, the Leapfrog Group? Pretty fantastic. Glenville Adventist, your mission is about taking care of us. So on behalf of the community and everyone that watches this show, thank you. Our topic has been all about our back and our spine and being mindful. Dr. Chong and Dr. Wong, pain becomes so bad. There's treatments. Some people believe in acupuncture. Some people believe in chiropractic care. Some people believe in other types of remedies. Just say pain becomes so bad. What are some of the surgical procedures that people can go through?
Sure. So it broadly breaks down into 2 categories. One category would involve people with pinched nerve symptoms as a result of changes in their back, whether it's bone spurs, bulging discs. And that can involve symptoms like severe sciatica, numbness, tingling, weakness in their extremities. Huge. Correct.
Which then sciatica then contributes to your TI band, to everything. It messes up your life.
Sure. The second kind of broad category is dealing with chronic back pain or acute back pain that has become severe and refractory, and in which we can identify a cause of that factor of back pain. Those patients that go through this whole non-operative spectrum, as you just described, and are dealing with severe disabling pain, may also be candidates for surgical intervention.
And what are some of the surgeries?
And the way it works is when we're dealing with symptoms of a pinched nerve, the operations are really geared towards freeing up those pinched nerves, whether it involves shaving away or removing a fragment of disc that's impinging or pushing on the nerve. It can also involve what we call spinal stenosis surgery, which involves removal of bone tissue and ligament to open up the space in the spinal canal for the nerves. When we're dealing with something like back pain, whether it's a result of a severely degenerated disc or severe arthritis in a section of the spine, the surgical approach that we often use is something akin to a spinal fusion. And what that means is you're essentially stabilizing that section of spine and removing motion in the areas where motion equals pain. And we know with arthritis, as the cartilage surfaces wear out, as the disc collapse, motion equals pain. So in broad strokes, it really involves either decompression surgery for pinched nerves or stabilization surgery.
And isn't there also another procedure where you can actually fry the nerve?
Correct. So we actually consider that along the non-surgical line of treatments is there are various kinds of spinal injections that can be done, and there's one type of injection around the joints that become arthritic in the back of the spine, where if you see temporizing relief with these injections, it may make you a candidate for the procedure called a dorsal rhizotomy or a radiofrequency ablation procedure, where they actually burn the nerve endings, the painful nerve endings around the joints.
And then you, doctor, you also spend a lot of time doing rehabilitation and non-operative treatments. What are some of those?
Well, like I mentioned before, I treat a lot of myofascial back pain, so I do some trigger point injections and releases for some of the tight muscles or the bruised muscles that got injured. Sometimes I also inject around the ligaments of the spine. Like Dr. Chong was speaking about, that we also do injections deeper into the spine, into the vertebral bodies and into those joints to help with the degradation and the pain from the degradation of those joints. Something else I do is acupuncture, and it can be helpful. It's a little bit more natural, and it's a very good alternative.
Because some people say holistic, but it's non-operative.
And it's a very good modality for, back pain just centrally that hasn't come down the leg, not that chronic sciatica. It can help people stay active and functional for years to come. And it's actually also a very helpful modality if they have actually had spine surgery and they don't have the sciatica anymore, but they still have some pain around their scar or around the muscle tissue. We can use the acupuncture in conjunction with their postoperative rehabilitation.
But then that also goes back to, as you were saying, rehabilitation and stretching and being mindful of everything you do. Before we leave, arthritis. Arthritis is hereditary. What is your suggestion or recommendation for someone that is suffering from horrible arthritis back pain?
What I tell patients with arthritis is that arthritis is a diagnosis, but we don't treat the diagnosis of arthritis. We treat the symptoms that come about as a result of the arthritis.
And the symptoms are pain.
Correct. Pain, stiffness.
Fatigue in the body part, the back.
Exactly. And it goes back to kind of what we've been emphasizing the whole time, which is we utilize all of these non-operative modalities, something as simple as core strengthening, stretching exercises along that kind of spectrum, or things like spinal injections or trigger point injections or even something like a radiofrequency ablation. All of these treatments are geared towards treating the symptoms that arise from the arthritis. Arthritis essentially is an incurable condition. Before everyone gets scared, it affects the vast majority of the population. And the goal, again, is to treat the symptoms of the arthritis as it progresses. And as long as the symptoms can be managed without aggressive intervention, we try to stick to that realm.
Can we prevent the onset of arthritis, or does it just happen?
It's part of wear and tear.
Okay.
So arthritis is just inflammation of the joint technically. And especially in your back and in your knees and all these weight-bearing joints, over time gravity will bring arthritis to you. But some patients are able to cope very well with it. They just have less painful joints because they limit their activity. They don't overdo it and do a marathon every weekend.
So people can actually overdo it?
Yes,
okay.
People can overdo their arthritis. And other things include some oral anti-inflammatories that may help their shoulder and their hip and their back at the same time. And the last thing is, maintaining some type of range of motion that's shown to be very helpful for arthritis.
One thing I want to address real quickly is people with back pain and obesity.
Sure.
Thoughts on that?
Yeah, I think unfortunately people tend to separate the two, but the two are incredibly intertwined. I think along the lines of this whole issue of arthritis, which affects a lot of our aging population, obesity is an added factor that can accelerate the wear and tear in our bodies. If you think about it, it's body weight times gravity, which is the stress that our spines are absorbing. And so, when we see patients in the office who are overweight, who are obese, who are actively gaining weight, those people are advised that if they have pre-existing arthritis, that can really accelerate, and their symptoms can accelerate as a result. And so part of our non-operative treatment plan for these patients is weight loss. Now, having said that, there are healthy ways to lose weight, and what I definitely encourage, and as a spine clinic we encourage, are low-impact aerobic activities where the joints don't see as much load and as much stress, but they're able to get that cardiac, that aerobic activity that helps them burn calories and to lose weight.
And what that means is get up, put down the holiday fruitcake, and walk outside. And we don't care if there's snow, because we're going to hear you talk about the weight you put on, celebrate the weight that you're taking off. Doctors, thank you so much. And since you talked about being mindful, I've tightened my cord the entire time.
Oh.
Thank you so much for paying it forward and doing all that you do.
Great.
Okay, so before you know it, it is New Year's. What are your New Year's intentions? Here at Healthline, we don't like to say resolutions. What are your intentions? Sit up straight when you're driving in the car. Have proper posture. It just doesn't happen. We are the captains of our ship, so be a great captain. If there's anything you heard today that you want to pass on to your friends and family, please do, because remember, the most important conversation you're going to have is about you and your health, so make it a healthy conversation. Please find us on Twitter, on our website, and also on Facebook. Thank you for joining us. Have a great New Year, and sit up straight. Be mindful of everything you do with you and your body. I will see you next year. Take care. Thanks.